too often I show up as a patient in a foreign land. Remember, I'm coming, my emotions, everything else, and I get to check in, and they're like, "Who are you?" I mean, come on. Because I'm not saying come on. Actually, what's happening is my emotions are now going here. It's 9 o'clock. It's my big day, and they don't know who I am, right? And it's a body language thing. Often in the hospitals, it's kind of like if you fly and you hit turbulence. If the flight attendants are still passing out Cokes, you're fine. If they run for their seats, you're scared, right? And it's the same thing in a hospital. Part of the job of a healthcare provider that we're talking to, it's part actor and actress. And not the caregiver part, okay? But part of it is, hey, you got to make it feel like opening night. Even when it's 4:30 and you've had a hard night, or you're about to go on break, or you've been working for 8 hours, that next person comes in, it's their big day, and you got to somehow really genuinely welcome them in that way. There's a temptation, I think, to think it's all about the doctors and to think it's all about the results. But everybody in that hospital has a really important role in the overall experience. So for me, I go to the hospital, and I said I've been 100 times, and I go in on average, let's call it 4 hours a time, plus or minus, chunk of time. I'm with the doctor that much. So I'm in the system for that much time. I might have actually had a phone call before. I might have some follow-up with finance after. This much time, the doctor's this slice. I might meet a dozen or 10 other people that actually have a bigger impact on the overall experience. One person can make a huge impact on somebody's life. And one person in the system can have a huge impact on the whole patient experience.